Hello and Happy New Year. I'm Lynn Doyle, welcoming you to a new season of Meet the Doctors. And to our new viewers, here's a little information about our show. Our aim here is to examine the facts so that you can make educated decisions. We want to empower you to take charge of your own well-being. We look at important health news, medical breakthroughs, and alternative therapies, and we tell you how they may be impacting you and your family. That said, here's what's coming up today on Meet the Doctors. There were quite a few medical breakthroughs in 2014, most notably a cure that could eradicate hepatitis C worldwide. But did you know millions of baby boomers are carrying the deadly virus and don't even know it? We'll be talking to a doctor whose mission is to get these folks screened. It could actually extend your life.
Almost all people in this country with hepatitis C were born between 1945 and 1965. So somewhere between 75 and 80% of all the hepatitis C in the United States is in the quote-unquote baby boomer generation.
And our own deputy health editor, Nick Tate, has a very special report on how genetically grown skin could be the next medical breakthrough for diabetics and our military veterans with hard-to-heal wounds. And of course, we'll have our very own panel of doctors who will be answering your email questions. But first, here's this week's news. Getting cancer may be just a matter of the roll of the dice. Scientists now say that about 2/3 of cancers are due to just bad luck and not to heredity or environmental factors. Random DNA mutations can occur at a time when stem cells divide. The more cell divisions there are, the higher the risk of cancer. Now, researchers calculated that 22 types of cancer, such as pancreatic, bone, ovarian, and brain, are often affected by these random divisions. They did not look at breast cancer and prostate cancer because there are not reliable estimates for the rates of those tissues' cell divisions. Well, take a look at him now. Former Detroit Lions quarterback Scott Mitchell has scored big time in weight loss. The 6'6" NFL star once tipped the scales at 366 pounds, but now he's scaled down to a slim 242. That after a season on the NBC hit show, The Biggest Loser.
So when I started the show, I weighed 366 pounds, and today I weigh 242 pounds. I've lost 124 pounds. I've been on the ranch 114 days, so I've literally lost over a pound a day.
Hey, not bad for a once out-of-shape athlete who weighed 130 pounds more than during his dozen seasons in the NFL, including, I might add, a stint with my beloved Baltimore Ravens. Mitchell spent 15 grueling weeks at the Biggest Loser Ranch, and from what it looks like, it was tougher there than at any NFL training camp. Which brings us to our next topic. I hate to burst the New Year's bubble because we're just barely into 2015, but only about 8% of Americans who make resolutions to lose weight and get fit actually succeed.
If exercise could be bottled, it would be the most effective and popular drug imaginable because it just affects your entire person in a very positive sense. It helps virtually every system in the human body, from your muscular system, your skeletal system, your cardiovascular system, which are the obvious ones. But if you look at the emerging research, its effects on the brain and the mind are phenomenal.
So my advice is start slow or restart if necessary, but definitely give yourself some slack. More than 3 million Americans suffer from advanced emphysema. That's the nation's third leading cause of death after heart disease and cancer. Now, until recently, doctors had little choice but to surgically remove the diseased portion of the lungs or to have the patient undergo a lung transplant. But now a tiny metal device called a lung volume reduction coil, or an LVRC, can avoid major and risky surgeries and actually increase quality of life. The device is implanted in patients' lungs and compresses the diseased tissue to allow healthy tissue to function and to open up small airways. And not only that, it's an outpatient procedure with almost no side effects. That's good news. A 17-year-old Connecticut girl continues to receive her court-ordered chemotherapy treatments she and her mother battled in vain to halt. The Connecticut Supreme Court found the homeschooled teenager, identified only in legal papers as Cassandra C., not mentally competent to make her own medical decisions. Now, doctors say her odds of recovery from Hodgkin lymphoma are 80 to 85% with the chemo, but without it, she would die. Cassandra had fought against receiving chemotherapy because she says she believes, quote, in the quality of my life, not the quantity. We wish her well. If you suffer from sleep apnea, try wearing knee-high compression stockings during the day. In a modest new study, 22 patients with obstructive sleep apnea who wore compression stockings during the day for 2 weeks saw the frequency of their erratic breathing decrease by 27%. That was compared to 23 patients who didn't wear them. At least part of sleep apnea is caused by increased fluid volume in the neck tissue, which is redistributed from the legs when lying flat at night. You see, that narrows that upper airway, and the compression socks exert pressure on the legs, and that reduces fluid movement. A new screening test has been designed to estimate a person's risk of developing coronary heart disease. The test is better at discerning the risk in women, notably Black women. To understand the significance of this new FDA-approved test for heart disease, we turn to our Deputy Health Editor, Nick Tate. Hi, Nick, and Happy New Year.
Well, hey, Lynn, same to you. You know, this new blood test that the FDA has just approved truly is a game changer for heart disease, which is the nation's #1 killer. Essentially, the test can predict a person's future odds for heart attack and other cardiovascular problems with a high degree of accuracy. It's likely to be a real lifesaver for people who have no history of heart disease, and as you say, it appears to be especially useful for women, and particularly Black women. The test tracks a biomarker of vascular inflammation known by the letters LP-PLA2, which can signal the buildup of artery-clogging plaques in blood vessels, and that can lead to heart attack. It's worth noting, Lynn, that for millions of Americans who suffer sudden heart attacks, they have no chest pain or early warning signs. In fact, for many people, a heart attack is both their first and last symptom of cardiovascular disease. So a test like this could really be a lifesaver. And just a little aside here, Lynn, there's new research out of Harvard that suggests that people who are pessimistic are twice as likely to suffer from cardiovascular problems, including heart attack, as those who are optimistic. So there's a couple good reasons here to be real positive and have a positive outlook. It's good for both your mind and your body, Lynn.
Nick, thanks very much. Another reason to keep a smile on our faces. That is it for the news this week. We'll take a short break, but when we return, Nick has a very special report on how growing your own skin in a lab could be the next medical breakthrough for thousands of diabetics and veterans whose wounds won't heal. Please stay with us. Welcome back. A plastic surgeon who grows patients' skin in his lab, it could very well be the next medical breakthrough in treating hard-to-heal wounds. Our own Newsmax Deputy Health Editor Nick Tate has this special report.
Lynn, millions of Americans suffer from crippling wounds that just won't heal, including burn victims, cancer patients, and even military veterans injured on the battlefields in Iraq and Afghanistan. But one doctor in South Florida is out to change all of that. He's using a revolutionary new procedure that has the potential to change the face of modern-day surgery. Essentially, what he's doing is harnessing the healing power of stem cells by using a sort of biological bandage that functions almost like a second skin. It sounds like science fiction, but in fact, the results of the work he's doing are just remarkable.
Our boys that went to Afghanistan that had bombs exploded, they lost their quadriceps mechanism, they couldn't walk. What they've done is they've taken the matrix, the biologic matrix, and they poured the powder in the middle of it and then attached to the muscles. 8 months later, they grew back muscle, able to walk with a cane. This is the future. It's here.
Dr. Harold Bafidis is a veteran plastic surgeon, and you might say he's giving conventional medicine a stunning makeover. He's already tried his new technique on more than 150 patients. He's used it to perform everything from simple hernia repairs and tummy tucks to more complex surgeries for serious and even untreatable conditions in some of his patients. Patients like Micheline Small, a personal trainer and mother of 4 from Jupiter, Florida, who underwent the pioneering stem cell procedure to repair a complex hernia that had left her racked with pain.
He told me prior to the surgery that he was going to do this and he'd think I'll be a good candidate for it. I said, I don't care, I'm just tired of the discomfort of this hernia. I'm quite happy with it.
How are you feeling today?
I'm feeling awesome.
Dr. Bafidis is one of the few doctors in the world using the new method, which incorporates a patient's own stem cells to treat burns, injuries, skin cancer, abdominal disorders, and other conditions. The technique employs a cutting-edge biologic mesh, or matrix, which is applied like a bandage over wounds and surgical incisions. The mesh is made from human or animal tissues and resembles a thin, flexible pie crust. It also comes in a powdered form that incorporates surrounding tissues in the healing process. The material becomes like a natural scaffolding on which the patient's own stem cells grow to help heal the areas quickly and completely. Why is it so significant? And I know that you've said that you believe that it is going to change the way surgery is performed. Tell us about it.
Yeah, the biologic mesh products, because there are so many of them, have evolved over the last maybe 10 years, specifically the last 5 years. They are almost uniformly sterilized terminally at the end of the process, and they are an open collagen matrix. That means that they allow tissue ingrowth. So they're not a permanent mesh. All the things that you heard about with mesh getting infected, they actually induce, in many cases, a reaction that recruits enzymes that will make stem cells and make collagen. And so you're getting basically new tissue ingrowth. As this goes away, it auto-integrates, and you're creating new tissue where you had old tissue, new collagen where you had old collagen, which is, to me, almost science fiction.
The novel approach is still in early stages and has been approved by the Food and Drug Administration only for use in treating burns and wound repair. But Dr. Bafidis believes the technique has far-reaching applications, and it could become a mainstay in operating rooms for many types of surgery in the years ahead. So as a pioneer, you're trying to get the word out. You're working with more medical doctors, other surgeons to try to...
Other surgeons,
Okay.
Other surgeons. And they've heard about it, they haven't seen it, and they're unfamiliar with it. So it's an interesting thing. The other part of this, which I feel strongly about, is that insurance companies, even though it's FDA approved and it's been out for 3 or 4 years, they're hesitant to pay for it because it's just more money that they can't keep to themselves. And it filters down to the hospitals. And it's going to be an issue where something that is absolutely going to be state-of-the-art and makes it better in the long run is going to be kept from people because insurance companies want to make money.
While the technique is still considered experimental, Dr. Bafidis is now teaching other surgeons how to use it at major medical institutions across the country, including Johns Hopkins. It seems likely to take its place alongside other major advances in surgery, like laparoscopic procedures and robotic surgeries that were once considered experimental. In the meantime, Dr. Bafidis is quietly going about the business of transforming lives, one at a time, by treating patients in his South Florida practice. Patients like Stella Francis, a life coach and counselor from Jupiter who underwent the stem cell procedure to repair a hernia and today says the decision was, in her words, the best thing I could have done for myself.
Fix the problem, and as a result I'm pain-free, no back pain, no belly pain, and no fear that something is very wrong.
That is an absolutely amazing report, Nick. Tell us a little bit more about how this will absolutely help vets and the VA.
Well, you know, Lynn, some of the greatest medical achievements in recent decades have been made in the arena of battlefield medicine. Doctors today are able to treat wounds that would have been fatal even a generation ago. In fact, that's one of the reasons that VA hospitals have had so many problems treating returning vets. There are just so many more of them than there were in past wars and past conflicts. But this new technique really holds a great deal of promise in treating veterans with such wounds. And it's not just for hernia repairs and tummy tucks, as we've seen. And in fact, Dr. Bafidis says that many of his patients are in fact wounded warriors from places like Afghanistan and Iraq. And what makes it so helpful for serious injuries is it not only promotes healing using a patient's own stem cells, but it also helps prevent infections because this biomesh is not a synthetic bandage placed over a wound, but actually becomes a part of the patient's own skin. So it's really truly remarkable to see the patients it's helped, and with Dr. Bafidis working with other hospitals and medical centers across the country to teach the technique, it seems likely that a lot more veterans and a lot more patients will be treated in the years ahead.
That is great news. Nick, thank you for telling us about it. One more thing before I let you go, though. I understand that you have a book coming out. Is it A Baby Boomer's Guide to Retirement?
That's exactly right, and thank you for mentioning it. The Baby Boomer Survival Guide is in fact out this week. What we've really tried to do is consult financial planners as well as some of the leading lights in health and healthcare to provide a very holistic guide to retirement planning so that it's not just a time of wealth, but also a time of health. A lot of people are thinking about how to save for retirement, but this book also provides ways that you can live well and not only be healthy and financially secure, but also be very, very healthy in your golden years. And we hope that it makes a difference for those folks who have yet to start their retirement planning and gives them a roadmap to do so.
Well, we wish you the best of luck with it. I'm going to be reading it this week first thing. Good to see you, Nick.
Thanks, Lynn. Appreciate it very much.
Sure thing. And speaking of baby boomers, how about Woodstock? That was the baby boomer generation of drugs, sex, and rock and roll. That is, until we grew up and became doctors, lawyers, and yes, even journalists, among other things. But those heady, drug-infused days of the 1970s may still silently lurk in our bodies. There's a dangerous virus that could be causing liver damage and even shortening our lives. Do we have it in us? We're going to find out next here on Meet the Doctors. Welcome back to Meet the Doctors. I'm Lynn Doyle. Here's a scary statistic. Some 75% of all hepatitis cases exist in the baby boomer population. That means millions of us are infected and we may not even know it. If that doesn't scare you, I don't know what will. It certainly got my attention. To get more information on this, we're joined now by Dr. Elon Weisberg, who is the Director of Hepatology at Lenox Hill Hospital. Dr. Weisberg, thank you so much for joining us.
Thank you. Thanks for inviting me to be here tonight.
I have a lot of questions about hepatitis C and why it affects baby boomers. But first, can you tell us what hep C is and why we should be concerned about it?
Absolutely. Hepatitis C is a virus that specifically targets the liver, and that's why it's called hepatitis virus. And it's a virus that is actually the leading cause of all chronic liver disease in the United States. In addition, it's the #1 reason in this country why people are referred for liver transplantation, and it's the #1 risk factor for developing liver cancer. So it's a very important health consequence, and we have a big important mission right now to try to identify all the patients with hepatitis C so that we can treat and cure them and prevent all of these very important complications of the infection.
Is hepatitis C almost always fatal, or does it almost always require a liver transplant?
No, actually it's the opposite. Only about 20 to 30% of all people with hepatitis C will actually develop cirrhosis of the liver. And this on average takes about 20 to 30 years to happen. And during that 20 to 30 year period, the infection is completely asymptomatic. So patients rarely have any even clue that they have symptoms or signs of the infection. Once cirrhosis is established, then there is about a 3 to 5% risk each year of developing liver cancer, and about a 10% risk of having decompensated cirrhosis where a patient would go on to need a transplant.
When people hear the word cirrhosis, they automatically associate it with drinking. Is hepatitis C associated with drinking?
That's a great question. Cirrhosis for us in the liver world really just means the advanced liver scarring. And you can have cirrhosis from anything that causes liver irritation and inflammation, be it alcohol, hepatitis C virus, hepatitis B virus, and other causes of liver inflammation. So cirrhosis does not just mean drinking or hepatitis C. Anything that causes chronic liver damage can lead to cirrhosis of the liver.
And yet chronic liver damage can be deadly to us. So we need to know if we are harboring this hepatitis C virus. And you've gotten our attention by saying that so many people in the baby boomer generation of a certain age actually have it and don't know it. How can that be?
Yeah, it's actually incredible. But most people who I see with hepatitis C who are newly diagnosed, they come to me scratching their heads saying, I've gone to the doctor for the last 15 years and it's never showed up in my blood. How is it possible? And it's because the virus can evade detection on blood work, and also because during that latency period, that 20 to 30 year period between infection and cirrhosis, there are usually no symptoms at all.
So how do we, as members of that baby boomer generation, take steps to protect ourselves, find out whether or not we've been exposed to it, and what we should do if in fact we have been?
Well, the statistic that's alarming is that almost all people in this country with hepatitis C were born between 1945 and 1965. So somewhere between 75 and 80% of all the hepatitis C in the United States is in the quote-unquote baby boomer generation. And almost 75% of these patients don't even know they have the infection because they've never been tested. So historically, we've only offered hepatitis C testing for individuals with a risk factor for hepatitis C, such as a history of a blood transfusion, history of IV drug use, or exposure to needles or tattoos. But what we've realized is that this is a very poor way to actually identify all the patients with hepatitis C, and we were doing a great disservice, because we are missing all of the cases of hepatitis C out there.
And that's actually your mission now, to try to get the word out to folks my age and the surrounding decades in front and behind that we should get screened. What kind of process is that?
Absolutely. So fortunately, it's my mission, but also one supported by the Center for Disease Control. About 2 years ago, a year and a half ago, the CDC came out with a very important mission statement saying that all baby boomers should be screened one time for hepatitis C, regardless of risk factors. And a lot of this has to do with the fact that patients sometimes are reluctant to offer truthful answers about whether they tried IV drugs one time in the 70s or whether they have had risky sexual exposure. Doctors are sometimes reluctant to ask their patients because they're afraid that it will turn them away and they won't keep having patients return. And so by eliminating these awkward questions in the doctor's office and just offering one-time Hep C testing to all baby boomers, we can hopefully identify all of these undiagnosed cases that exist.
So what is actually involved in the testing? Is it just a blood test? Something simple?
It's a very simple blood test. We test for the antibody to hepatitis C, and if you have the antibody, it doesn't mean you have the infection, it just means you were exposed. But the antibody is a very quick and rough and dirty test, and it's a great way to cheaply screen a large population. If the antibody test is positive, you have to then be referred to a liver specialist for confirmatory testing, which is checking for the actual RNA viral load. And then if you have that, you have chronic infection.
Should we ask our doctors on our regular annual exam if they could include a test for hepatitis C when they're also checking, for other diseases or vitamin levels, hormone level, that kind of thing? Is it up to us to ask if our doctors don't recommend it?
Well, certainly I think empowered and informed patients are going to be the healthiest patients. And even though this is a CDC recommendation, there is certainly a catch-up that has to exist before all the doctors in the community are aware of this, amongst many other CDC recommendations in the last year or two. So we are strongly recommending that all patients advocate for themselves and ask for a one-time hepatitis C antibody test.
Hey, I'm putting it on my list of things to do for 2015. Now, let's say the test comes back and we have been exposed to hepatitis C. The news for people who learn that they have it is better this year than it was last year.
Absolutely. So historically, hepatitis C diagnosis was a very terrible burden to wear. First of all, the stigma of having hepatitis C was very difficult for people. And then on top of that, there were very few curative treatment options to offer patients. Historically, the treatment for hepatitis C was an entire year of very strong and toxic medicines. Specifically, it was interferon injections once a week, which caused a whole slew of side effects like flu symptoms, and people missed work and were fatigued and lost weight and lost their hair. And also ribavirin pills, which had a whole other slew of symptoms. And a year of that treatment only yielded a cure in about 30 or 40% of patients, so less than a coin toss of being cured. These days, we have eliminated interferon completely from the treatment for hepatitis C, and with that, almost all of the side effects. We've shortened and truncated therapy down to just 12 weeks for most patients, and it is a cure rate of over 90 to 95%.
Wow, that is excellent news. But more importantly, we want you to take your own health into your own hands and empower yourself, as the doctor pointed out, and ask for that test for hepatitis C. We're going to take a short break, but you'll stay with us to answer some viewer questions.
Absolutely.
I know they have a lot of them. We will take a short break, but when we come back, Meet the Doctors will continue with its panel of doctors answering your questions. Time now for you to literally meet the doctors. We invite a panel of doctors and they very graciously answer the questions that you have emailed in to us to the best of their ability. We always remind you to get medical advice from your own personal physician, but this is a great way to start the dialogue and to give you some information that perhaps you didn't have before you tuned in here. Let me introduce this week's panel. We are joined by Dr. Karen Patel. She is a pain specialist in private practice at the Spine and Pain Consultants of New York. And once again, we're joined by Dr. Elon Weisberg, who, as I said, is the Director of Hepatology at Lenox Hill Hospital. Great to have you both with us.
Thank you.
Now, of course, Dr. Weisberg, after we just talked about hepatitis C and the impact that it's having on baby boomers, we've gotten a lot of questions about it. And one of the first things people are concerned about is more specifics on how they may have contracted it.
Well, hepatitis C is a blood-borne virus, so you really have to be exposed to contaminated blood in order to get hepatitis C. So this means either sharing needles with someone who has hepatitis C, receiving a blood transfusion or a blood product from someone who has hepatitis C, and rarely it can be passed on from mother to child during delivery. Now, the good news is that since 1992, the United States blood supply has been very aggressively screened, and there have not been any cases of hep C transmission through blood donation. But people who have had a blood transfusion or received blood products prior to 1992, they may have been exposed.
Our question from one of our viewers says, my husband has hepatitis C and we like to share food, take sips from each other's glass. I feel like I'm at risk. Are these activities that I should stop getting it or stop sharing with him?
Absolutely not. You know, hepatitis C is not transmitted through casual contact. And again, the vast majority of hep C in this country is in the baby boomer generation, so a lot of people with hep C are married, have children, grandchildren. We encourage people with hep C and their families to continue hugging and kissing and having normal day-to-day activities. There are some reasonable precautions to take, like not sharing toothbrushes, not sharing razors, because there can be potential blood there. And then the question that everyone's afraid to ask, that I always make sure we bring up, is whether or not you can have sexual relations with your husband or wife if they have hepatitis C.
Now, it's funny because I'm not afraid to ask that question, and it was actually the very next question that I was going to ask, because I know people are at home and they're saying, if you have hep C, if you get that diagnosis, if you're dealing with it, doesn't mean that intimacy has to leave your life.
Absolutely not. Hep C is not an STD, a sexually transmitted disease. Very, very rarely it has been documented where it was passed on through sex, but because it is such a rare and infrequent occurrence, we don't even recommend any special precautions or barrier contraception like condom use. You can have normal sexual relations with your husband or your wife or your partner if one of the partners has hepatitis C.
Dr. Patel, is there pain that's associated with hepatitis C?
Well, what we often see is that with end stage, when there's cirrhosis, when there's changes to the liver that's developed, and there's ascites, there's fluid that accumulates in the abdomen, there can be pain related to kind of end stages of hepatitis. But the actual, the infection, the virus itself, no, not necessarily, not at all.
All right, I hope that answers your questions. And we always want to remind you that if you do have questions for us, we'd love to hear from you. You just go to newsmax.com and find us, and we'll try to answer as many as we can. Cirrhosis has gotten a lot of interest here. People want to know if they are at risk if they have 1 or 2 glasses of wine a day, or is cirrhosis merely limited to alcoholics?
It's a fantastic question. I think 2 parts to it. One is that, again, cirrhosis just refers to end-stage scarring of the liver, so any chronic liver inflammation can lead to cirrhosis over time, and alcohol is certainly one of the commonest causes of cirrhosis. it's important to point out that both men and women are at risk for developing cirrhosis from alcohol. There seems to be this notion that men get alcoholic cirrhosis, and especially women have a lower threshold for developing liver damage because their bodies maybe metabolize alcohol at a different rate. 1 or 2 glasses of wine a night is probably a safe limit, but if your doctor ever counsels you against saying that you're drinking too much, then you could be at risk for alcoholic liver damage.
What advice do you give to women when they talk about drinking and what's considered too much or not enough?
You know, a lot of questions I get from patients are, oh, well, a glass of wine a night or 2 glasses of wine a night is okay. It's good for my heart. It's good. It prevents cancer. And I try to set that straight in the sense that, you know, 1 glass of wine, red wine, 5 ounces is a serving of red wine, and that is what we've seen has been associated with a lower risk of heart disease. Now, you know, more than that, there are studies that don't completely clearly show that, you know, drinking wine, particularly red wine, decreases the risk of cancer. But what we do know is that it's related to the antioxidants that are found in the compound resveratrol. And so red wine has more than white wine. But again, you know, women have a lower tolerance because their body volume is lower than that of their male counterparts. So that has to be taken into consideration. And we have to remember that a serving of wine is 5 ounces.
5 ounces is nothing. 5 ounces is for amateurs. I have to take a short break, but we have more of your questions that we're going to try to answer right after this. Stay with us. Let's continue with your questions, most notably about hepatitis C, because people now have a lot of interest in it. You've given us a lot of useful information. Big concern among our viewers is how much is all of this going to cost if in fact a blood test indicates they do have hep C?
Well, as I mentioned earlier, the treatments have really evolved in the last few years, and we now have been afforded the ability to cure 95% or more of all people with hep C using very short regimens of just 12 weeks duration for most patients that does not require the use of interferon with all of its toxic side effects. So at this time, there's really 2 excellent treatment options that are available to us. They both consist of just pills, no needles or injections, and again, they cure 95% or more of patients. Figuring out which regimen is appropriate for you is something you would have to discuss with your doctor. These treatments they're not cheap. They're kind of expensive to treat people, but what's important to recognize is that treating and curing hepatitis C has been over and over again shown to be cost effective, because if we can cure people with hep C and prevent cirrhosis and liver cancer and the need for transplant, it's associated with tremendous cost savings for the healthcare system.
So it's really important that we take this opportunity to try to eradicate hep C, not just here in the States, but worldwide.
Yeah, and with the advances in medications now, it's really exciting that we're getting much closer to that.
And let's hope so. Now,
hep C will be gone. We are able to cure hep C. This is really the beginning of the end of hepatitis C.
Wow, that's great news.
Yeah.
Another question that came in from our viewers is if you in fact have hep C, if you have taken the test and you've learned that you do have it, or if you're living with it otherwise, should you get a flu shot? This is the time of the year when everyone's concerned about getting the flu. Is it a yay or a nay for folks with hep C?
Yay.
Yay?
Yeah,
Definitely.
I say absolutely, absolutely. Relatively immunocompromised state, I think it's relevant to have the flu shot. The question that I often get from patients who are on these treatments is, you know, I do procedures for pain. Is it okay for me to have procedures, or what other medical care should I avoid while I'm on this medication? You know, certainly I think the advice is any steroid. You want to avoid exposure to steroid.
Okay.
Yeah, steroids can increase the activity of the hepatitis C virus in the liver, so we don't really recommend steroid doses in patients with chronic hepatitis C. It can accelerate the liver damage. But if you're on these treatments, it's also important to discuss any new medicines and herbal medicines that you might be taking with your doctor, because there can be some very important drug interactions that can lead to a loss of efficacy of these very important hep C therapies.
Well, since we mentioned the flu, it wouldn't be Meet the Doctors if we didn't ask about the flu shot. One of our viewers has a concern about the flu shot, did not actually get it this year because they heard that it wasn't really effective, that this strain that's affecting so many people across the nation is not really responding to the strain that we're getting in the injection. Any validity to that, or should we get it or should we not get it, or does it matter?
Well, there are multiple strains of the flu virus, and I think there is a benefit from having the flu vaccination to some of the strains that we know are out there. Now, we are seeing this flu epidemic, it's being called, from a strain that you know, is very virulent, if you will.
And apparently it's very, not only awful for people who have it, but deadly.
Yeah,
for
hospitalizations are up this year, absolutely.
Yeah, it's frightening. I have grandsons, and I've been hearing that children are really being adversely affected by it.
And the best thing we can do is, you know, the vaccination for the strands that are available, and then also basic precautions, hand washing, you know, if you're in escalators or doorknobs, you know, to use paper towels to open these things in public areas. I mean, it's really a bit of common sense and vigilance.
I was on a plane the other day and I had my gloves on and my scarf around my face, and I wouldn't take my gloves off inside because I didn't want to touch anything. I didn't want to inhale any germs from my fellow passengers, and everyone was coughing and hacking and sneezing. I was like, oh gosh, didn't want to look like Michael Jackson, but I almost had my face mask on.
But it's not just the flu virus, it's also bacteria, and that's probably more common than, say, the flu virus.
Okay.
And I think that's something equally we have to be cognizant of, you know. You sneeze, you cough, you know, wash your hands. Wash your hands as much as you possibly can.
And if you're sick, stay home. Please do us all a favor, stay home.
Don't get on the subway.
We just don't tend to do that, do we, in America? We feel like if we stay home with a cold or the flu that we're somehow going to get a bad rap for it at work, but I encourage people to stay home. All right, here's an interesting question. I love this. My father drank a couple of glasses of wine every day for most of his adult life. He died at 89 from emphysema, even though he was a pack-a-day smoker. Is it possible the wine helped keep him from developing lung cancer and that he lived a longer time because of drinking the wine?
Well, you know, as I had mentioned before, resveratrol is the antioxidant that's found in wine and higher in red wine than white wine. What we know from studies is that a glass, a single 5-ounce serving of red wine, is linked to lower rates of heart disease. We don't necessarily see the same association in terms of prevention of cancer in red wine or white wine. But in moderation, it can be enjoyed. Now, whether this particular person, whether that contributed to him not developing lung cancer, it's up to speculation, really.
How come we always talk about white wine and red wine? Where are the studies on vodka and scotch and gin? Yeah, I mean, you know, no one ever talks about the hard liquor. As someone who deals with this all the time, what do you suggest when people ask you about drinking that kind of alcohol?
Well, truthfully, what we hear is the opposite. I'll ask people whether or not they drink alcohol or how many drinks of alcohol they drink a day, and they'll say, oh, I don't drink any, just a few glasses of wine a day. And I think there's a misconception that wine is somehow not alcohol. You know, wine, beer, vodka, it's all ethanol. And ethanol is what is toxic to the body and damages the liver. It's the other aspects of the beer or the wine that might have different effects on the body. So I think the ethanol in vodka and wine and beer are all equivalent in terms of their risk for liver damage, but there are obviously other benefits of red wine that come from the non-ethanol component.
And what piece of advice would you give to our viewers to make 2015 a healthy and happy one?
To stay active as much as you can and keep everything in moderation. You know, enjoy the things that you love in life, but balance them with a healthy lifestyle.
And would you agree?
Yes, and I would add to that, spend more time with your family, don't work too hard, and you know, be good to yourself.
All right, great advice. Thank you so much for being with us. And we want to add that you definitely want to get screened for that hepatitis C, particularly if you are a baby boomer, which we all are. We want to thank you so much for watching. I'm Lynn Doyle for Meet the Doctor. See you next time.